All right, so we are trying to look at a group of drugs, and we are trying to actually look at a group of drugs. We're trying to look at, if you give it to a pregnant woman, what will be the effect and what issues do they help to solve in pregnancies. So these SSRIs are what? Selective Serotonin Reuptake Inhibitors. So what's the application of this group of drugs in pregnancy? We also look at the examples of the drugs that actually fall under this category. So they are among the most commonly prescribed antidepressant drugs. You know that most pregnant women, they actually fight with all those issues of depression and all. You understand? So these drugs, they are helping to solve depression issues. They are against depression. So they are used during pregnancies, all right, and because of the side effects they have, you have to talk about them especially. Do you understand? Because they could cause some issues too. All right. So balancing the risks and benefits is experts emphasize that untreated depression during pregnancy can pose a risk like a woman killing herself. The stress can be transferred to the baby, and the baby will want to be delivered before time. You understand? You can give birth to a baby and low birth weight. Okay. Impaired bonding. Right. The mother gives birth to a baby and she's not falling in love with the baby. You understand? So also drugs like sertraline are considered safe and effective for many pregnancies. So most of them do not increase the risk of birth defects. Okay, do you understand? So the FDA panel controversy. A recent panel considered adding a black box warning to what? Selective serotonin reuptake inhibitors, citing that their side effects have some one or two issues on the baby. All right. So critics included American College of Obstetricians and Gynecologists. They called the panel alarming unbalance, noting it failed to address the dangers of untreated maternal mental illness. Many panelists have risks of skepticism towards antidepressants, okay, rising concerns about the bias. Like the whole thing is like these drugs are important, but they have their side effects too. So some people are now trying to make studies to make sure that okay, these side effects are not actually affecting the babies and all, you know. So, but just know that they remain a front line or first line, okay, if you want to treat depression, okay. Decisions should be made collaboratively between the patient provider, okay, the patient and the provider. So you have to weigh the benefit and the risks. You have to also weigh if there are other alternatives. You understand? If this person can handle a particular depression by going on vacation, if the person can afford a vacation, go on vacation rather than take drugs. Do you understand? If the person can address this vacation by doing yoga, the person should do the exercise rather than, you know, taking drugs, you know. So just so you know that discontinuing it abruptly due to pregnancy can lead to relapse and increased risk of harm. Sometimes you are taking drugs for depression even before you got pregnant. If you just stopped it because of pregnancy, your depression can come in. Do you understand? So this have to do with a lot of what? Reasoning from your healthcare provider. But that's just it for these drugs and their applications in pregnancy.